So this is my assignment on treating injuries. So the first injury we're going to look at is a head injury. And as we can see in this clip, two players are going up for a header. However, one of the player's elbow actually collides with the other player's head, as we can see there, causing the player to go down with a serious head injury. So to treat a head injury, we'd use doctor's ABC. Firstly, any other danger will be checked. So as you can see, she removed the football so that any other potential injuries are removed. She's then going to check to see if the player is responsive. She does this by asking him if she can hear him, and he can, so she asks him to sit up nice and gently. She's then going to ask him to look at her to see if his eyesight has been impaired. She does this by holding up a couple of fingers, asking if he knows how many fingers she's holding up. He answers correctly, so she moves on to asking where the pain is, and he says on the side of his head. So she then says she's going to treat this by using an ice pack, which she's getting now, and she will do this by taping the ice pack to the side of the head so that it stays in place. Now, in our scenario, the player was responsive. However, if it turns out that casualty is not responsive, then the next stage of Doctor's ABC would be used, which is shout for help. This involves calling for someone around to come and help treat the injured player, or possibly calling an ambulance if needed. The player's airways would then be checked to make sure they are breathing, and if they are, then they should be moved into the recovery position to help clear the airways. However, if they aren't breathing, you should then perform CPR, which involves performing 20 beats onto the patient's chest, followed by 2 breaths of air directed into their mouth. This would then be repeated until further help arrives. So in the clip, we can see she's then going to ask the patient to stand up and remove him to a bench so he can sit down and relax. So injury number 2 is a cut or a bleed. So in the clip, we can see a player who is dribbling towards the hoop trying to shoot. However, he realises that a defender is now coming into frame who will try and stop him from scoring. As he goes up for a shot, he goes for the shot, he manages to get it off, release the ball. However, on the way back down, the defender's arms actually come down and scrape the player's arms. This causes a cut, as we can see in this clip, which will have to be treated using Sul-Taps. So firstly, the girl will ask the player to come and sit down so he can relax. She'll then put on gloves to make sure that she's not spreading any further bacteria into the area. She's then going to have a look and see if she can ask the player where it hurts. She's then going to see if he can move his arm, which he can. She's then going to touch around in the area to see if there's any further pain, which there's not. And then she'll move on to the treatment process. So firstly, she'll use an antibacterial wipe to remove any further bacteria or dirt that may be still in the area. And then she will use a bandage to wrap around the cut to keep it clean and protected from any further damage. She does this by using the bandage, placing the pad of the bandage on the infected area and tying the strings around to keep it in place. So the next injury is a broken arm. As we can see in this clip, the defender is standing below the hoop, ready to try and defend her hoop against any oncoming attackers. And as we can see, an attacker is oncoming here. However, in her attempts to defend it, she actually gets shoved. And this causes her to fall back and land awkwardly on her arm, causing it to break. So again, we would use the process of Sul-Taps. The boy is firstly going to ask if she can sit up, which she can. He's then going to ask to look at the injury and see if he can touch it and see if she can move it in any way. She can't. He's then feeling around the area to see if there's any further pain, which there is. And he's then going to ask to try and move the arm up and down, which he can't. He's then going to ask her to kind of gently stand up so that he can begin the treatment process. So to treat a broken arm, he will temporarily use a sling until further treatment can be provided. So he does this by firstly taking one part of the sling and wrapping it underneath the injured arm. He will then take the other side and wrap it over the top of the injured arm so that it can be secured in place. He'll then tie it at the back of her head so that it stops coming undone. And then we'll take her over to a bench to sit down until further treatment is provided. So the final injury is a sprained ankle. And in this clip, we can see a football match being played where one player is dribbling with the ball and the other is jockeying, trying to defend. However, the player with the ball suddenly performs a trick which causes the defender to have to kind of move back suddenly, which, as we can see, causes the left ankle to roll and cause a minor sprain. So for this type of injury, the process of RICE would be used. So firstly, the player will be tended to see if they can move. He'll then tell the player where the pain is and ask if they can move it, which he can't. So he'll then be asked to stand up and gently move over to a chair to sit down and relax, and then the treatment process can begin. So to treat this kind of injury, we'd first use an ice pack to help stop any swelling or pain, and this would be kept in place using tape, which also helps to compress the injury and reduce any further swelling. So we're compressing the injury and keeping the ice pack in place using some tape, which will stop the ice pack from falling off. So tape is being put down, which has secured the ice pack. Then we'll use a chair to help elevate the injury